Jumper's knee, also known as patellar tendinopathy, is an overuse injury that affects the tendon connecting the kneecap to the shin bone. Here are some simple steps to relieve and manage the condition. Number one, rest. Avoid activities that put strain on your knee, especially jumping or running. Allow your knee to heal in time. Okay? Number two, ice. Apply ice packs 20 minutes a day, several times a day, to reduce the swelling and pain. Number three, compression. Use a knee brace or a wrap to provide support and reduce the swelling. Number four, elevation. Keep your knee elevated on the pillows when resting to minimize the swelling. Number five, stretching and strengthening. Once the pain decreases, gently stretch the quadriceps, the hamstrings, and the calves. Strengthening exercises for the muscle around the kneecap can help. Number six, physical therapy. A physical therapist can guide you through specific exercises and treatments tailored to your condition. Number seven, non-steroidal anti-inflammatory drugs, NSAIDs. Over-the-counter pain relievers like ibuprofen can help reduce pain and inflammation. Number eight, gradual return to activity. So once you feel better, gradually reintroduce activities, starting with low-impact exercises. And if the symptoms persist, consult a healthcare professional for further evaluation and treatment options.